Just going to turn off the transcription because we don't want a full-blown transcription of everything we're saying. Transcription has stopped. Yep, recording's active. Okay, so we're going to kick off by, again, having a look at this Athena navigation video. So I'll get back to you in 7 minutes.
In this video, we will be outlining the functional navigation of the K2 Athena system. Please ensure that your username and password have both been set up prior to accessing Athena. Upon logging into the system, the first page you will see is the home screen. For ease of navigation, this has been divided into 5 separate tiles. On the home screen, you will also be able to adjust your settings via the Tools wizard. Here, you can view software information, adjust the font to your preferred size, see any updates, view the log file, change your password, check your network connectivity, and view regulatory information. It is important to note, once you are finished using Athena or are away from your device, you will need to either log out, exit, or lock the system. This is in order to comply with information governance and data protection laws. There are various ways that you can find women that have been admitted onto the system. The first being via the Locations tile. Here you can find clinics as well as inpatient wards. In this example, we will look at an inpatient stay and show you how to admit a woman to Argyll. At the top of the screen, you will see the Admit Woman button. Clicking this will take you to the search bar where you can find the woman you'd like to admit, either by inputting their hospital patient ID, NHS number, name, or date of birth. Each woman admitted will have a 3-dot menu where you can select some quick actions that need to be undertaken. Or you can go into the View Full Inpatient Notes, and this will include everything that can be entered throughout the inpatient stay, in managed tabs for ease of access. These tabs include admissions, management, risk assessments, clinical assessments, observations, specialisms, investigations, fetal assessments, procedures, labor, and outcome. Going back to the home page, we will now look at the Teams tile. The teams are separated into different staff groups for ease of access. The first one we will look at is Specialist Referrals. Behind this screen you will see Pending Referrals, which the team can either accept or reject. We also have our consultant teams. Here you will see all women assigned to a consultant. Next is the midwifery team. Here you will see all women assigned to a midwifery team. You can also filter the search so that you can see women assigned to an individual midwife. In the Management of Women team, you will see a list of all women. You can filter by teams, assigned midwife, and assigned consultant. There is also a safeguarding team that women can be referred to. The third tile is My Desk. Next to My Desk is the Quick Tasks tile, which can be used for a new booking or to enter delivery information. For a new booking, once you click the button, you will have the option to search for the woman you would like to book. You can do this by inputting her hospital patient ID, NHS number, first name, surname, or date of birth. The final tab on the home screen will be mainly used by admin staff and team leaders. Here they can create custom reports from data that has been entered into the system. Here you can see the search button. We will now use this to search for an example woman. Please note these are test patients and we will not be using real patient data. Once you have searched for your patient, the system will ask you to confirm that you have selected the correct person. You will need to check and select yes or no. This will take us into their main notes. The main notes are divided into sections at the top, and when you hover over them, more selections will appear. The tabs are divided into the woman's profile, obstetric profile, medical profile, social profile, screening profile, plan of care, communications, pregnancy outcome, and audit. The next tab is the consultations and admissions, where you can view any helpline contacts. You can view the booking to-do list and all information entered. You can view antenatal consultations, see hospital stays and visits, and lastly view postnatal consultations. The antenatal tab includes plan of care, observations, specialisms, procedures, investigations, fetal assessments, and pregnancy outcomes. This is designed so that anything entered during an inpatient stay or consultation will all appear here in one easy-to-view place. This is the same for the specialisms, where anything entered will pull through. In investigations, you can view investigation history and make more offers if required. Next is the intrapartum section. This is mainly covered by the Guardian system, but here you can see anything intrapartum that has been added against the woman, view baby information, and view reports. Then you can view the postnatal section, with the postnatal summary, observations, investigations, baby checks, plan of care, checklists, and discharge from care to health visitor. The final tab across the top is the green baby button, where you can view previously entered information, as well as record new information regarding the baby post-birth. On the main notes screen, you can also see several icons on the left-hand side. The risk flower in this instance is pink as the pregnancy is high risk. If the pregnancy is low risk, the flower will be green, and if data is yet to be entered, it will be gray. You can select the flower to perform a risk assessment and view active risks. Next is the meds icon, which should be used to enter any patient medications. The final icon can be used to add a new referral by selecting a referral reason and destination. There is also an Actions tab where you can view active actions, add new ones, and view completed ones. The three icons here are indicative of domestic abuse, social services involvement, and safeguarding. These icons will change, depending on what is added in confidential mode. Confidential mode can be accessed by clicking the C in the top left-hand corner and authenticating. Once you go into confidential mode, look at the social profile where there are more tabs available to enter. These are highlighted with the flashing C to indicate that they can only be viewed in confidential mode. If you leave confidential mode, the C icon acts as a prompt to let you know that there are more hidden tabs. This brings us to the end of the functional navigation of K2 Athena. Thank you for watching.
Okay, thanks everyone. So again, you may have seen that before. It's just to kind of reinforce how to navigate and find your way around the system. Okie dokie. So we're going to get cracking with today's outpatient postnatal training. So just to give you a little bit of context for today's session, we'll be looking at 3 scenarios, 2 mothers and 1 baby. So we're effectively demonstrating the key functionalities of the system using the metaphor of these journeys and that of the baby at the end as well to demonstrate everything. So our first mum has had a preterm C-section and needs wound care. Our second mum has had an instrumental delivery and will require a perineal referral. And our baby, unfortunately, is a reluctant feeder. So we'll come back and we'll revisit all this stuff as we work our way through. So in regards to logging in then, you'll find the Athena app amongst your other clinical applications in the departmental icons folder, and you'll be logging in using your standard Windows username and password. I did this on the last course as well. That's a really good start, isn't it? Let's try that again. There we go. That's a bit better. So here we go. So in previous training, if you've attended previous training, you may have been shown how to locate a patient in a ward context. As we're now looking at the outpatient setting, you're going to need to search for your patient via this icon in the top right-hand corner. So let's go to search. Okay, so for the purposes of training today, I'm going to have to search using the patient's name, just due to the limitations of the training environment. Obviously, in real life, we'd always advise that you use your NHS numbers or your hospital numbers, which can be populated up the top. Okay, so I've got more than one lady of the same name here. So I'm just going to use, for example, the date of birth or the hospital patient ID to find the one I'm after, which is this one here. And there we go. So we've now landed in what we call the woman's notes section of the system. And if you've attended training before, and even if you haven't, one of the best things to remember about the system is you just find the tab that relates to what you're looking for at the top. And when you click on that tab, you're going to have, excuse me, you're going to have relevant options down the left-hand side. So we'll see that form of navigation repeatedly as we work our way through the course. We can see that this lady's under CLC, consultant-led care. Yeah, I was assuming it would be midwifery-led care, but I had a chat with Francesca this morning, who effectively said they always show as consultant-led care if they've been under consultant previously. It's a high-risk, low-risk thing, so that's why it's showing as CLC. If you have attended any prior K2 sessions, you might notice some additional options and tabs that you wouldn't have come across previously. So for example, we've now got, in this context, a postnatal tab. And if I just move away, we've also got the baby button now as well. So in regards to the options we can see here, I'm just going to signpost one as an example of a function that's available within these new lists. You've got your blood spots. So we will revisit that as we work our way through the course a little bit later on. So I'm just going to hit the back button. Okay, as you can see, these menus are very, very sensitive. They do come up a lot when you put your mouse in the wrong place. Top tip then, just move your mouse a little further up the screen and those drop downs will disappear. So there's a couple of options that I'd like to signpost to you at this point. And the first one is going to be, if you bear with me, the timeline. So when we hit the woman's notes screen, the profile, and then the brief option here are highlighted as a default. I've got a timeline down here, so I'm just going to quickly show you that. And in case you're wondering, what is it? The timeline is a complete record of the patient's maternal journey. So any information in this pink section is what we call the historical data, and anything on this side of the screen in the white are future events, like, for example, appointments that haven't even happened yet. What you can do is click on the past time markers, for example, to view information from that event. So I'm just clicking on birth of baby there, just as an example, and then we can scroll down and have a look at that information if we need to. So it might be useful to check the timeline at the early stages of seeing a lady, or even if before you see her. Something else that would be really advisable to check would be to have a look at this risk flower, which I know you saw mentioned in the video. So let's have a look at the risk flower now. It's really key to look at the information behind the risk flower, just to ensure that you are aware of any risks and that the family is receiving the correct and appropriate level of care. As mentioned in the video again, risk assessments can be added to or amended at any point of the care. And not every patient will have a risk, but they'll always have a flower available. Again, as mentioned in the video, if you've got a pink flower there, it means it's heightened risk. If it's green, it's normal or low risk. And if it was ever grey, that would mean that no risk data had been entered at all up to this point. Another thing that I'm just going to ask you to be aware of before I hand over control to one of you folks is it's always a good idea to check your actions. So it's up the top again. So we've got the risk flower that we've just looked at, the video reference medication. We'll talk about referrals later on. Here are your actions. So this is something that Francesca's asked us to emphasize. If the patient's been booked in over the phone, rather than face-to-face, for example, things like your blood pressure, height and weight checks might be outstanding, and you obviously might have actions referring to that. So we're just highlighting that at this stage because Francesca said this could be particularly relevant to MSWs, for example. So please bear that in mind. Okay, so just to remind you, as I mentioned previously, we're going to look at two scenarios for the mums. And then on the second mum, we're also going to talk about that second mum's baby. We're going to focus on the different mum assessments first, if you don't mind. So to remind you, our first mum, that we're going to talk about today has had a C-section and requires wound care. Now, at this point, I need to be honest with you and own up. We are having a few issues today, unfortunately, with our training patients. So effectively, I'm going to have to use the same mum twice. Okay, but it won't impede on the training in any way, shape, or form. I'll still be able to cover everything that I need to. Before the mum's assessed, before we actually sit down and see mum, there's just a couple more background checks that would advise you to complete before you speak to her. So let's cancel this one and have a look at some of the options at the top again. So I'm going to go to the postnatal tab. Very key that we move our mouse down slowly so that menu doesn't disappear. And then I'm going to scroll across and we've got a delivery summary here. So it's under postnatal and to the left, delivery summary. So it might be a good idea to have a quick check of that one. Again, scroll down. There's the bulk of the information there. And then something else that might be useful to have a look at is under the profile tab. So again, highlight that, move my mouse down slowly so I keep all those options in situ. And if I move across to plan of care, I've got S bar history, which again might be worth another look. And then we can see what's been going on with our patient. So she was transferred from CDS to transitional care, and then from transitional care to Women's Day services. If you want to have a look at the information contained within those handover documents, those S bars, then by all means, you can click on the dates there to have a better look. Okay, so done some introductory bits and bobs with you there. Is everybody okay? Has anybody got any questions? Because please, if you've got them, don't hold back. Just shout out. Is everyone okay? Any questions? That's a no. All right then. So what I'm going to ask is, again, rather than you ladies having to sit there and just take this download of information, it would be really nice if I could potentially give some of you access to have a play on the system before the go live. So I'm just going to see who I can give control to, or do I actually have a volunteer at this point? Has anybody got a
I don't
volunteer?
mind.
Who was that? Who was that?
It's
That was Helen
Helen.
Weeks. Oh, get on, Helen. See, you're my favourite now. All right, don't tell the others. All right, so what I'd like you to do is give your mouse a little wiggle for us. There she is. Hi, Helen. Great stuff. I'm sharing my screen with you remotely, okay? So you might find when you do have a practice that things might feel a little bit twitchy at your end. That's just because we're doing this online, all right? And in real life, it should obviously be a lot smoother than that. So
Yeah.
thank you very much, Helen, for mucking in. Okay, so we've now reviewed the history, haven't we? And we've done those background checks that I've just signposted to you. So we're now going to complete an assessment for our first mum. So what I'd like you to do, Helen, is if you can come up to the top and go to the consultations and admissions tab and just hover over that and just very gently move your mouse down. That keeps the menu there. Could you scroll across to postnatal for me? Postnatal visits. We're going to do this 3 times, okay? So if there was any historical assessment data there, we'd see it when we click on Mother Assessments, please. There we are. So we can see, oh, it's off my training course, look. So we can see we've already done an assessment for this mum in an inpatient setting. We can see that and review that information if we need to, but we're going to add a new assessment, please, Helen, at the top. You've done this before, look, you know exactly where to go, don't you? Rightio. So what does this do? For those of you who haven't attended one of these courses before, when you click on Add New, it opens up what we call a wizard. What is a wizard? It's simply a very intuitive form, and you just fill out the fields as required, okay? And don't worry, if you've missed out any fields that are really, really important or even mandatory, the system will give you a little pop-up message to warn you, okay? So first things first, Helen, we'll talk about observations. Now, it's my understanding that maternal observations, or i.e. a full set of obs, would only be done in an outpatient setting if we had major concerns. Okay, so
Yeah.
if that's the case, could you go up to perfusion and we'll start there. So we'll go to perfusion good, if that's okay. And then we'll scroll down to Lockyer normal beneath that, thank you. Yeah, and then we'll go Lockyer offensive no underneath that one. You've definitely done this
Sorry.
before. No, that's fine. This is great. And can you go to Albert for that one? So there we go. Now I was speaking to an MSW earlier today, and she was saying, well, we wouldn't normally record things like Alba. We wouldn't normally, as an MSW, record anything in regards to fundal height. Listen, ladies, all I'm going to do is I'm going to show you the functionalities of the system, okay? And you fill out the form that in a manner that suits you best. And again, if you've missed something important, you'll get a warning, all right? So thank you very much. You've already done the sedation neuro response bit. She's alert. We're going to go for below umbilicus, if you don't mind. And then we'll go to face at the top. And then we'll go uterus status well contracted and firm. And then can you give me a next, please? And again, if we'd missed anything important, we get a message now, and we haven't. So in regards to the assessment of wound and trauma, can you go to perineal trauma at the top and say no? And it's a dynamic form. As soon as Helen did that, look, it's gone. Okay, we don't need these elements now. This lady's had a C-section though, so we're going to go abdominal wound present, yes. And then if we go underneath that, skin closure details in this scenario will just be a beaded suture, please. Thank you very much indeed. Now, as you can see beneath that, we've got comments. We've got comments. So you fill out the comments boxes as you see fit. So I'm going to click on this one. Would you mind, and I know it's horrible when people watch you type, so I appreciate you doing this. Could you give me a stitches removed in there, please, just as an example? So you're a much better typist than I am. I couldn't even log in on my first attempt, could I? Condition of wound, can we go clean and dry? And then we'll also select another one, please, dressing removed right next to it. And then we're just going to go next. I know you're hovering over that field, but again, not all these fields are mandated. So fill out the form as you see fit. In regards to removal of non-dissolvable sutures, this one down here, could you just tick this box there to say they've been removed, please? Fantastic. And then, okay, so look, in real life, we'll be putting in the names of the people who did this, that, and the other. I'm not going to ask for that today. Could you just type in the word test for me?
Oh,
Because that
sorry.
isn't, you did that on purpose to demonstrate a mandated field. That's perfect. And just choose test clinical or test therapy, please. That's all I'm going to ask you to do today. And if we go to next. Right then, so here we go on to the anesthetic questions. So again, I believe you could skip that if you wanted to, but we're going to actually show it today just for the purposes of training. So she is, yes, able to move her legs. Sensation, yes, is back to normal. No headache, please. Oh, we saw a little pop up there though, didn't we, when we clicked yes? It was saying about referrals. So if you click certain fields, it might warn you if a referral would be a good idea at this point, but we will cover referrals. Backache is no. And she is satisfied with her care. And if you can now click next, which takes us on to sensory scoring. So we're under the understanding that that wouldn't necessarily generally be completed in community. So you could skip it if you wanted to. So shall we? Yeah, very good. So we've got a further assessment now. Okay. So we'll go to breasts and nipples, no concerns, please. We're happy. Legs, no concerns, please. No pain. And then a next. So we talked about sensory scoring and how that might not be applicable. And here we are now talking about pressure ulcers. So could you just say that's not completed and then go to next for me, please? So again, it's our understanding that it's unlikely a pressure ulcer check would be required in a community setting, and it's unlikely, therefore, that you'd need to do a risk assessment. However, if you did need to do a risk assessment for pressure ulcers, you could simply hit add new, and what that would do, it just opens up another wizard, which you complete. So it's like a wizard within a wizard, but I'm not going to complete that today. So if you could give me another next, please. Okay, so the first urine void after delivery. Okay, that happened quite some time ago, so that's already been pre-populated for us. So I'm going to ask you to go to bladder and do a no concerns, please. Okay, and that's all we want to fill out on this screen. You don't necessarily have to fill out the other bits, but you could if you wanted to. And then that takes us on to, oh, there it is, our old friend, the Bristol stool chart. We're not going to dwell on that too often, but we'll just say that the lady's told us she's a type 3 and move swiftly on. And we'll go to next. Thank you very much. Postpartum psychosis, we're going to say that no to postpartum psychosis diagnosed. And then we'll go next. You're really close now. Well done. So we're going to go fatigue, no concerns. Emotions, no concerns. Oh, yes, I remember this from when my wife gave birth. Yes, we'll go pelvic floor, please, on the postnatal exercises. And she has not been seen by a physiotherapist. You could add comments if you wanted to, but we're not going to do that on this occasion. So I'm going to ask you to click finish. So we're having to do an assessment twice for this lady. So we're pretending at this point that she's the lady who's had the C-section. I'm having to reuse the same patient. But didn't she do well? Absolutely fantastic. Helen, thanks very much indeed.
Thank
So
you.
I'm going to cancel control for you. No, ladies, don't make me pick on people. Can I have another volunteer, please? Who fancies it? Who wants to have a go?
I'm happy to volunteer.
Amber, you are now my favourite. Don't tell Helen. There we go. Fabulous. Could you? There she is. Wiggle your mouse. There she is, ready to go. Okay, so we're now going to pretend that we've completed our first patient's postnatal appointment, the lady with the C-section. So we're now going to move gracefully onto our second mother. So just to remind you, she had an instrumental delivery, perineal trauma, she had heavy blood loss. And what we're going to discover in a little bit is, bless her, she's also got bladder issues as well. So we need to go right back to the start. So could you give me a home button here at the top, please? Excellent. And then if you could go to search, because we're going to pretend we're searching for a new patient. So in the first name, could you give me a Rebecca, please? Much better typist than me again. And then a Young. And if you could just hit enter or search, yeah, that's fine. So we're going to go for the lady at the bottom of the list. So let's just say we've confirmed a date of birth, for example. Just click on that one. And we've seen this before, haven't we? It was the same patient. So as ever, if it was a new patient, though, you'd still land on the woman's notes screen with the profile bit highlighted as a default and the brief highlighted as a default as well. So we're now going to move on to our second assessment on the next mum. So if you could go to consultations and admissions at the top, please. And if you could just pull that mouse down very gently. Okay, we're going to go to postnatal visits on the right-hand side under consultations. And then, just like we did last time, mother's assessments on the left, please. That's the one. And there we are. So we can see the one we did for our other mum, shall we say. So I'm going to ask you to go to add new assessment. But the great thing is you can see the historical assessments that have happened beforehand on that screen. So once again, we're going to say we're still not doing maternal observations, and this is going to start off quite similar to the last lady, all right? So bear with me. We're going to go perfusion good. We're going to go Lockyer normal again, and we'll go for Alba. Oh, and Lockyer offensive no as well, please, sorry. Yeah, so you're fast. Okay, so we're going to go for a yeah, and below umbilicus, face to face in the top corner, and then well contracted and firm. You've definitely done this before, so we're going to go down to next. Thank you very much. So at this point now we're going to see some changes. So this time we're going to go and say perineal trauma, yes. Excellent. So we're now going to go down to just beneath that, please, sutures present. Yes, and the type of perineal sutures are dissolvable. Here comes the pressure then. I'm going to ask you to type in some comments for me if you don't mind. And the comments are, wound appears to have broken down.
Oh, it's not type. I'm typing on my side.
Oh,
there we go.
So, hey, well done. Don't worry about the caps. Oh, don't worry about it. It's absolutely fine. Wound appears to have broken down and signs of infection seen. Wow. Can you do all the typing on this course?
The spelling might
Fantastic.
not always be right, but
Oh, what's a spelling mistake between friends? Okay, so we're now looking at this one here, condition of perineal trauma. Okay, so we're going to say, oh, I don't even, how do you pronounce this again? I've done this before. Exudate? How would you pronounce that?
I don't actually know how you'd pronounce that.
I think Francesca wasn't sure if everyone would be comfortable with that terminology, so that's to do with the pus. That one, I'm sure you do know that. We're also going to go for increased pain, unfortunately, in that box. I'm going to go to inflammation beneath it as well. Yeah, we are going to say we've taken perineal swabs, which I might come back to. Sutures, swabs taken is a no. No comments on this occasion. And if we go to abdominal wound present, we'll say no. And then again, dynamic form blanks all this out. Yeah, thank you very much. Next, please. Okay, so once again, if the patient hasn't had an anesthetic, you could effectively skip this section. But I'll tell you what, for the purposes of training, let's keep doing it. So she is, yes, able to move her legs. The sensation, yes, is back to normal. No headache or backache, please. And is she satisfied? Yes, she is indeed. I'll tell you what, let's add a comment this time because you're so fast on the keyboard. Let's say no pressure, no anesthetic care.
Oh, you're testing my spelling now.
Oh, it's above it. It's all right. We've got it above it there. Yeah, you're fine, aren't you? And then go next. Here we are, sensory scoring again. No need to do it as she's not had an anesthesia. Again, to the best of our knowledge, mainly used in an inpatient setting. So next again. But it's there if you ever needed it. On this one, no concerns for breasts and nipples or legs, please. Yeah, fantastic. And no pain. And then we'll go next. And then we're back to pressure ulcers again. So we'll say not completed and next. And as I showed you earlier, we're not saying you won't ever have to do one, but if you ever did have to do a risk assessment, I showed you a minute ago, didn't I? There he is. So we'll go next again, please. Just as we saw before with the previous patient, the first urine void after delivery is pulled through from earlier input. But we did mention, I did warn you, we're going to discover she's got some bladder problems. So let's put urgency for that one, please. And the mum's comment in regards to that is that she doesn't feel like she's fully emptying her bladder. Look at this, look, rapid. Awesome. And if we could then say urine passed since last assessment is a yes. And then we'll go next. There's comments there if you need them, but we're not going to do that. Oh, here we are again. So we'll swiftly go for a type 3 and a next, please. But we got the chart there, should you need it. And postpartum psychosis is a no. And the keyword at the top of the screen there is conclusion. And the keyword down here is finish. That means you're really, really close. So can we go no concerns in regards to fatigue or emotions? Pelvic floor again, please. And seen by physio is a no. And then we'll finish. So again, apologies, we had to double up, didn't we, and pretend this patient was two different patients. But again, any historical information there is available for you to view. One thing I will mention is we've just done these two together now, haven't we? So if I scroll down, you do have the benefit of having an edit button if you need to go in and you think, oh, I made a mistake there, so you can go in and change that. Now, as you're doing such a good job, would you mind if I asked you to do one more little thing for me? Is that okay?
Yeah, that's fine.
Right then, so and thanks for that, due to what's been assessed at this point, I'm going to show you how to raise a perineal referral, okay? So if you could go to the purple person. So we looked at actions earlier, it's purple person time for referrals. And yeah, please excuse us. This is one that's just carried over from the inpatient training. So we can see an active referral is here. When it's been completed, it will move across to this one. In regards to the anesthesia referral here that we could see, when we raise this on the inpatient course, in case you're wondering, that will send this behind the relevant door for the anaesthetists in the K2 system. But it's just a message I need to reinforce that's kind of carried over from the inpatient training. We've been told that the anaesthetists, for example, as an example of a referral behind a door in K2, are going to check it once a day. So if you've got any major concerns, then we'd still recommend bleeping or calling if you want to expedite the referral process. So that wouldn't change. So yes, if you could go to add to referral for me, please. Okay, so it's going to be a perineal referral. So we're going to say referral status made, just slightly above where you are. And if you go to referral reason and just click the drop down, oh my me, isn't that a long list? So could you try and hit the letter P on your keyboard? And then if you scroll down just a touch, that just speeds up the search. And Francesca said for this one, and again, I'm not clinical, so I'm assuming this is some type of overarching banner. Physiotherapy issues is the one we've been told. There we are. Physiotherapy issues. Thank you very much. Referral made by, obviously we'd be putting in the name of the appropriate individual there, but just pop in test for me today if you don't mind, and then clinical or Derriford, whatever you fancy. And then unfortunately we got a bug here, so could you click on referral destination? This is unique to the training environment, okay? In real life, I believe you'd be looking for something along the lines of pelvic health service, but we just can't replicate that on this list in training, I'm afraid. So if you could just go down and click finish for me. I'll do it if it's not working. There we are. Lovely, lovely, lovely. Okay, so can we now save that? If you go to the green and save, and then you are in the clear for now. And we can see that the referral icon up here is updated now to show number 2. So this one should have gone anyway from our previous training, but we've got the one that we've just added in. So thank you very much indeed for helping out and having a go. So I'm going to cancel your control. Right then. So far, Helen and Amber are my favourites. Who wants to be the next favourite? Don't make me pick on people. I hate being a bad man. Who's going to have a go?
I'm happy to do it.
Amanda. Well done. You're now my favourite. Don't tell the other two. So if you could wiggle your mouse around for me, please, Amanda. There she is. Right. So at this point, everyone, I just want to reiterate something important that, again, if you've done the training before, you would have heard this probably more than once. So as you're aware, I'm sure you're more than aware that mental health assessments are mandatory at every appointment as it's an Ockenden requirement. So as you should have filled this out in previous training, or maybe you haven't, all we're going to do today is just signpost where you can find it, because we're not actually going to fill it out for our patient today. So your first challenge, Amanda, is to go to the profile tab. Whoops, I just did it for you. So if you go to the profile tab. Yeah, and just wait for something to appear and gently move your mouse down for me. And then if you move across to medical profile, and it's just there. There's your mental health assessment. Okay. And then you just go in and add new. It's just another wizard, and you'd follow the prompts accordingly. Okay. So it's there under profile, medical profile. It's also available under other tabs. I've seen it under postnatal and the postnatal tab and then plan of care. So quite like a lot of other applications, sometimes you can find the same thing in more than one place. I'm just going to ask you to cancel that form in the top right-hand corner for me, and then hit yes in green, please. Again, it's another form. Just follow the prompts. Okay, so what are we going to ask Amanda to do next then? So going back to our scenario, as we took perineal swabs, we're going to create an action now for this second mother, and that just acts as a reminder that something needs to be done for this patient. There you go. That's the one. If you could click on the action for me. And if you remember, we talked about checking the actions at the start of the appointment. If you're an MSW, there might be some things that are outstanding that need to be picked up. Could you go to add action? Now, the type of action here isn't on the list, so we're going to have to go to other, please, Amanda. So the bottom option, and a little bit of typing now. Be warned, I'm going to ask you to type in review perineal swabs, please. I think we need to put that, well, you can put it there.
I did.
But
I
let's
was
put it in
down
this one.
further, and I don't know why it went up.
Probably Teams being twitchy, don't worry. Review perineal swabs, please. Look at that, perfection. Now, we've been told that ideally your target date up here for that one would be 4 days. So if you could go to the calendar for me. So it's the 9th today. Can you just roll it forward 4 days on the 13th? Yeah, that's lovely. Okay, so we've also been told on the live system that you would need to be assigning this one to yourselves as it's your responsibility. That's what we've been told. So that's why I know you're putting in test, but we'd need to be assigning that to ourselves. And if you can pop that one down as pending underneath, please. Okay, and then finish. Okay, I'm not going to ask you to save just yet. Okay, so we can see now we've got 2 actions outstanding. Again, apologies for this one. This is just one outstanding from the previous course. So this is the one we're going to focus on. The icon's updated to say we've got an additional action there. So you're probably wondering, well, how do I shunt it here from active over to completed? So that's what I'm going to ask Amanda to do now. So you could click on the blue text here, please, Amanda, that says other. And then can you see it says complete? So you go in and complete it. And if you just pop today's date on it, because it will ask for a date otherwise. And if we just finish that one, please. Okay, so now we can see that's gone down to a 1 because we've got this old action here and it's moved to completed. So that's how we create actions and that's how we go in and complete them. All right. So we are flying through this, and as Amanda's doing such a good job, I'm going to ask Amanda to do something else before I give somebody else a go at the baby assessment. Is everybody all right? I know I'm doing a lot of talking. Any questions? Okay, fantastic. So Amanda, you're doing brilliantly. So I'm going to ask you to hit the cancel button for me, if you don't mind. And yeah, just click yes to that one. Alrighty. So finally then, before we look at baby and we give controls to somebody else, we're now just going to record or create a quick management plan for the mum. So you've got a record of what you've done. So I'd like you to go up to your postnatal tab, just to the left of baby. And if you scroll down for me, please. And if you look across to the left, yeah, you got it. You're good, you lot. One step ahead. That's what I love. So if we can go to, there's old management plans there that we can view, but we're going to go to add a new management plan. And then you need to select management plan from that grey box. And surprise, surprise, what do we see? We see another wizard. So the plan type would be, you got it, postnatal mum. And the plan was made during your outpatient consultation. And obviously that was face-to-face to the right-hand side. So if you can click in the big text box now. So just to back up the referral and the action and get that recorded on this plan as well, would you mind typing, please, referral to perineal team? Referral to perineal team. And then a comma. And then we'll just go chase swabs. Okay, so I hope that's looking nice and authentic to everybody. So if we move down, yeah, you'd just put in test. Obviously, you put your name in there, but we're just going to put test clinical, test Derriford. And to the right-hand side, it has been agreed and discussed with mum, and it's still relevant. And then we finish. Look at that. Seamless. Amanda, thank you very much indeed. Right.
Yep.
Cancel your control. Ah, who else is up for it then? Who's going to have a go? I mean, the ladies have set the bar really high. All right, so no pressure, but who fancies a go? Or I'll just have to pick somebody off my list. Oh, you're going to make me be a bad man, aren't you? Amelia Nosworthy, I don't think you've had a go, have you? Hi, Amelia, you still there?
No worries. Yeah,
Yeah,
no
thank you
worries.
very much. So you're my new favourite, don't tell the others. There's a pattern developing here as well, isn't there? Right, give that mouse a little wiggle for me, Amelia. There she is. Right then, so we've done the assessments for both mums, we've done actions, we've done referrals, we've done management plans. It's time to start thinking about baby, this mum's baby. So if you could go to consults and admissions at the top for me, please. Yeah, there you go. And then surprise, surprise, I'll give you a hand. It's Teams. Surprise, surprise, we're going back to where we went before. So if we go to the right to postnatal consultations and then postnatal visits, please. There you go. And this time, instead of a mum, we're going to do baby. So we'll go baby assessments. Okay, so we can see here from a previous course, one of my courses in the inpatient setting, that we've done an assessment before. We can review that if we need to. We're just going to go to add new, please. Awesome. Rightio. A couple of things to mention at this point. First of all, could you give me a face-to-face type of care in the top right-hand corner? So just up here, face to face, if you don't mind. Oh dear. I think Amelia's having a bit of trouble. Are you still there, Amelia? Or have we had a dropout due to Teams issues? I think we might have had a dropout due to Teams issues, everybody else. I'm just going to cancel and give control again. Are you there, Amelia? Or have we lost Amelia? The joy of online training, everybody. So I'm going to cancel control. And I know the rest of you weren't expecting this. Oh, I'm now having a bit of trouble with my Teams. Oh, that's seamless, isn't it? Right. Okay. Do any of you have an accept option on your screens at the top? Does anybody have an accept control option at the top?
No, I don't.
You don't?
No.
Okay. That's not a problem. What we're going to do is we're going to stop sharing and then we're going to start sharing again and see if that kickstarts everything back into life. I'll see if I can give control. There we are. Oh, I think we might have lost Amelia because she's dropped off my list completely.
She's been locked out. She says she can't get back in.
So she's with you, Olivia.
No, she's just messaged me.
Oh dear. Oh dear, well, I'm going to have to carry on. At least we're recording this. So Amelia can always, when she does get back in, hopefully she can watch the bits she's missed. So hopefully Amelia will be back with us shortly. Who's going to step into the breach in the meantime then? Or am I going to have to be really horrible and start picking on people?
I don't mind having a go.
Oh, Jodie Pitt. Well done, Jodie Pitt. Good stuff. Well done. Give your mouse a little wiggle for me. Okay, so let's go back to where we did. Can you give me a face-to-face type of care in the top right-hand corner, please? Okay, so this is what we've been told about OBS. All right, so the observations field, all those fields aren't necessarily mandatory because, again, we understand you wouldn't typically do OBS as a standard in this scenario unless, however, there were any abnormalities identified during the assessment. Are you happy with that? So, yes.
Yeah.
Lovely. So therefore, for training for now, we will not be completing OBS at this stage. However, please bear this in mind. If a decision is made to transfer baby into the hospital later, we would definitely need to record a set of OBS at the baby transfer stage. So we might well come back to that. Okay, Jodie. So in this example, the fields that we will fill out will be starting here, your tone and activity, please. So if we can go to tone and activity and we'll say responsive good tone. Thank you very much. And then we'll say feeding reluctantly, which therefore causes in the box underneath high parental concern. So the alarm bells are beginning to tinkle a little bit. We're not going to do anything with blood glucose or any of these other fields. So if you can click next. And remember, if one of those fields was really important, you'd get a pop-up to warn you. So baby's weight. So just to mention something to you now at this point, if the baby has a 10 to 12% weight loss, then a feeding management plan needs to be written. I'm sure you're aware of that. And if it's more than 12%, then we're going to be thinking about that transfer to TCW. So baby's weight currently is 3,500 grams. What I'm going to ask you to put in, Jodie, if you don't mind, I'm going to ask you to pop in 3045. There we are. Straight away, we can see the system's telling us 13%. It's over 12%. So we're thinking of TCW, which we'll revisit very shortly. So in regards to the comments, sorry, you're on the spot now when it comes to typing. Would you be able to type in, please, weight loss over 12%? And then, sorry, 12%. Yeah, and then we'll say reluctant feeder. Brilliant. Thank you very much. So in the upper right hand corner, let's go skin color normal with no comment. And then if we go down to jaundice, if we could select Minolta required, which I believe would be a bilirubin check. Okay, so if you're happy and you know it, let's click next. Jaundice comments. Oh, yeah. I'd like to say that was a deliberate mistake on my part, but it blatantly wasn't. Could you give us, please, because we talked about bilirubin check, didn't we? 145 millimoles, please. 145 mmol. And then if you could give us a full stop, and we'll also have a yellow to sclera, please. Yellow to sclera. Awesome. Oh, well, at least we saw a pop-up. So there we go. If we could click next. Okay, the system's not doing anything other now than just double checking that that value is what you wanted to put in. It was greater than 10%. Well, if it is 3045, it's 3045, isn't it? So it was correct, Jody. So if you could click yes, it's just the system double checking. Okay, so these are going to be quite straightforward. Mouth is normal, if you don't mind. Yeah, great. And gums are normal. Left and right eye normal in this scenario. And then our left sclera, right sclera, please. Can we have jaundice for those ones? Talking about jaundice, bilirubin checks and all that. Lovely. So if we could go next in the lower right-hand corner. Bowel status for baby is opened. And then we'll go firm and yellow. So both options there. Yeah. I remember my daughter's was green, but that was a long time ago. And if we could go to past urine, yes. And that, again, dynamic form. As soon as you click that, these options become available. Let's go for under 4 wet nappies in 24 hours, please. Fabulous. Cord status, top right-hand corner is going to be normal. Okay, sleeping is also going to be normal, so slightly beneath that one. And then in our scenario, we've got nothing else to fill out, so we're going to click next. If I've missed something important, I'd get a message. Right, ladies. Okay, so before we do this bit, I've got some information direct from Michelle Hambley. So I just want to read this out to you, and then we'll see how you all feel about that. Okay, so this comments box here, Michelle would advise you to elaborate on your assessment using this box. So particularly for additional information on the baby's feeding, as the initial boxes regarding feeding and the OBS didn't really go into a lot of detail. So again, we'd encourage you to record wet and dirty nappies here as well, and whether they're normal or not. So essentially, we want K2 to enhance our documentation. So we need to record the feeding and output in a bit more detail to reflect the clinical picture. Now, I could be really nasty, Jody, now, and ask you to write all of what I'm about to read out in your comments box, okay? But to be honest, I'm just going to read you out, everybody, what Michelle suggested at this point. And then I'd just be interested to know what you think and whether that reflects that clinical picture, because I'm sure you feel it will. So what she's recommending is the information we could put in would be, for example, things like unsettled at breast, feeding 3 to 4 hourly, less than 5-minute feeds, falls asleep at the breast, positioning and attachment reviewed, 2 wet nappies in 24 hours, 1 was dirty green, weight loss over 12% for review on TCW. So Jody, I've got you here now because you've been brave enough to volunteer and have a go. So it was all about using those comments to reflect that full clinical picture. You think that those comments would do a pretty good job at reflecting that clinical picture?
Yeah.
Yeah, is that the type of
Yeah.
information you'd be looking to put in?
It is, yeah.
Yeah, absolutely fabulous. So shouldn't be doing this as it's a recording, but let's just type in test. As long as you're all happy that what I've just read out would be the type of information you'd be putting. In fact, I'll do it for you, Jody, because you've been so helpful.
Thank you.
Okie dokie. So, how's everybody feeling? Is everybody all right? Do we have any questions? Are we all on board with what Michelle was suggesting there for that comments box at the end of the baby assessment? If you're not,
Yeah.
okay. Yeah, everyone's all right? Yeah. Okay, and if you're not saying anything, ladies, I'm assuming you're okay. But I got a yes there, so I'll take that. Right then. So what were the last things that Michelle suggested for that comments box? Weight loss over 12% for review on TCW. So from that assessment and those final comments, we're now going to start talking about a transfer to transitional care. So I'm going to go in and finish that one for us. Okay, so you know now, you know the drill. I'm looking for another victim, not victim, another volunteer. Or I'm going to have to start picking on people again. Who hasn't had a go, who fancy to go, or who just wants to get it out of the way? Looking through my list, looking through the list.
I'll do it.
Who's that? Oh, it's an Amy King. You were the next one on my list. Well done, Amy. Give your mouse a wiggle, Amy. Let's see her. There she is. Well done, Amy. Right then. So yeah, we're now going to transfer the baby to transitional care on the basis of what we've just discussed. One thing I need to be really clear about, because I know it's easy to worry about our process is going to change now we've got a new system. You will still need to follow the current process of calling the on-call neonatal registrar. Okay, so you still need to make the call. But this process does, however, replace the paper SBAR. Okay, so it's my understanding that historically we'd give the paperwork to mum and she'd take the handover in with her, but this process will replace the paper SBR, the paper SBAR, sorry. So with that in mind then, what we're going to do is, Amy, we're going to go up and have a look at that green baby button at the top of the screen again. There you are, fantastic. Okay, so and we will come back to other options on this screen very, very shortly, but I'd like you to move across to the left and then find baby transfer for me. Baby transfer, it's right down the bottom. Well done. Okay, so we're going to go to add new again at the top, like we normally do. Transferring clinician and receiving clinician, again, we'd put in the appropriate people's IDs, yeah, like your own, for example. So we'll put in a test again. Yeah, and then receiving clinician, which I appreciate would probably be an SHO or a midwife on TCW. We'll just put in test again. Either option, clinical or Daraford. So in regards to transferred from, in future, there should be a specific children's centre option, but on training, we haven't got one. So if you could go to other right at the foot of that list for me, please, Amy, yeah. And then if you could type in children's centre. Okay, and destination on the right-hand side, as we know now, will be postnatal transitional care, please. And then we'll go next. Oh, I'm going to ask you to do a little bit of typing for me, Amy. Is that all right?
Yep.
All right, then. So we're going to say in the reason for transfer box, we're going to say 13% weight loss. Awesome. And then, and again, these are just the examples we've been given for training, right? I appreciate you're going to put in whatever you need to. So if we have a comma, can we have newts, NEWTS, equals button or a hyphen or anything like that? Yeah. Query jaundice to body, because we talked about that earlier on. So query jaundice to body, yeah. And then after that, let's have a comma. PU times 3, that's your past urine, I believe, PU times 3. And BO, bowels open, times 2. The weight now is 3045G. Thank you very much. Doing a great job here. And then a full stop, and we'll have discussed with neonatal registrar. You're all much better typists than I am. Neonatal registrar, please. Yeah, and then we'll just have transfer agreed at the bottom, at the end of that. Transfer agreed. Yeah, same box. Yeah. Because we talked about that phone call, didn't we? Okay, so if you could click in the transfer comments for me, please, Amy. Okay, so we did say earlier on, didn't we, about the OBS? Okay, we discussed that earlier on and said if we're not capturing the OBS, okay. However, we would have to record some OBS at the baby transfer stage if that was what was going to happen, and it is, isn't it? So could you give me, please, heart rate? Doing a great job, yeah. It's 122. And then temperature is 36.9. Yeah, the RESPs would be 37. And we'll also add 2 more words, please. Pink and lethargic. Definitely done this before. Superb. And then if you give me a finish, please. Just in the bottom right corner. Lovely. There we are. So we've done the transfer to TCW ward as well. Now, Amy, you're doing a great job. So that means I'm going to keep you on. I've got a hand. I'm so sorry. Amanda, you've got a question.
That's okay. It was just that if we don't know the clinician we're sending into, what do we do? Put in that box, or have we got to name somebody in it?
Okay, if it's not a mandated field, okay, you'll be able to hit next and skip it. Okay, and it's happy days. If it is mandated, then I think you're just going to have to try and explore that on that phone call to TCW. Is that okay?
Yeah, fine.
Brilliant. Okay, so going back to Amy, who's doing an awesome job. Amy, I've got one more job for you, and then I'll pick on another volunteer. Right, so in regards to the chronology of this scenario, when we were talking to Francesca about it, she said, as soon as you became aware of this situation, your natural instinct, ladies, would probably have been to jump on that transfer to TCW straight away, which is more than fair enough. Okay, so that means we brought that transfer to TCW section forward a little bit because that would be a natural instinct anyway. So that means we've just got one little loose end that we need to tie up now whilst we're on that screen, and it's in regards to your blood spots. So Amy, if you move across to the left-hand side and go to blood spot screening for me. Fabulous. And we're just going to add new again. Talk about blood spots for a little bit. Verbal consent gained, yes, I bet you have to, because I remember my daughter screaming the house down when this happened. And we could go through and just say, yes, I've mentioned this. Yes, we've talked about that. Or, Amy, you could just go to all explained and do it all in one hit if you'd rather. And the same with all accepted. And then if you can go next for me, please. Sample taken, yes, indeedy. And we'll say the site of that sample would be the foot, please. Now, in regards to your card number, I know we haven't got the card with us, so can we just put in 1, 2, 3, 4, 5? Yeah, and then location would be Children's Centre again. And then the expiry, going back to the card, let's just go to the calendar and say 1 month from today. So if you want to go to your arrow, yeah, fabulous. It's the 9th, isn't it? Yeah. And then screened by, obviously we put in the right name there. So we'll just put in test today. Yeah. And then you could put in comments if you wanted to, but we're just going to go straight to finish. So there we are. That's quite easy. Recording the blood spot on the system here. In case you're wondering, so just in case you've got that little question in your head now, the maternity screening team would record the results just by clicking on enter status here. Okay, that's where they'd go in, the maternity screening team, to record that when the results are back from the lab. It's just a little bit of additional information for you there. Didn't Amy do well? Fabulous. Thank you very much, Amy. Right. Cancel control. Who hasn't had a go? Olivia, did you have a go?
No,
well,
I have not.
how are you feeling about it?
Yeah, fine.
It's the right answer, and it makes you my new favourite. Don't tell the others. Awesome. So we are flying through this. Is everybody okay? Please shout if you're not. I'm assuming you're okay. Yep. Okay. All good. All good. So whilst we're talking, we're still on the blood spot screen. So there's just one other option that I'd like to demonstrate to you that you might find useful when you're on this screen. So at the very, very top in the upper left-hand corner, Olivia, it says baby. So if you click on baby for me, all I want to signpost is this bit here, print blood spot labels. So if you ever needed to reprint your blood spot labels for one reason or another, you could access that via baby and just print them off there and then. Okay, and that's literally the last thing I need to show you in regards to blood spots. So Olivia, could you give me a back button, please, and we'll go back to the previous screen. Now this one's going to be interesting. This one's going to be interesting because I had a chat again with an MSW earlier on today. What we're going to have a quick chat about before we start thinking about concluding the journey is your postnatal PBR, your payment by results. So I was speaking to the MSW earlier on. He was saying that's not something MSWs normally do. I'm wondering now if I can call on my secret weapon, Claire. Is Claire still with us? Claire, was just out of interest. I don't know. I didn't know the answer to that question. Would MSWs be looking at the payment by results screen?
No, they
No.
wouldn't.
Okay. So what about midwives rotating into an outpatient setting?
It
Would they?
depends what the options give you.
Okay. Should we have a look and see what you
Yeah.
think? Right. Okay. So any idea why we should be checking the payment by results? What do we want to ensure? That the trust gets what?
The money for the care.
Bingo. Yep, 100%. It's just make sure we get paid correctly. So there might, Claire, be a chat from MSWs then in regards to, or should we or shouldn't be doing this? And again,
Yeah.
maybe midwives as well. So let's have a look at the form. So Olivia, I've been going right off on one there, haven't I? So can you go to profile, just underneath where I am? And if you pull your mouse down very gently, please, to keep these options active, could you then go to plan of care? There's towards the middle. That's it. And scroll down and you'll see PN, postnatal payment by results there. Okay, so this is all about making sure we've been paid correctly. So for example, if the delivery summary and the risk flyer and risk assessments have been checked, as we talked about earlier on in the course, and if all the other wizards have been completed appropriately throughout the patient's journey, then the PBR should be populated for you and should be populated correctly. So it's very much a case of casting your eye over this. And obviously you'd be using your clinical judgment when you're doing it. We're pretty much going to say no to everything. But what I'd like you to do is, Olivia, if you could click enter edit postnatal PBR for me. And the first thing I'm going to signpost is this screen here. Yes, the trust was the intrapartum lead provider. And yes, the trust is the postnatal lead provider. So we'll go next. Okay, so the first button I want to signpost is up here. So we can see the current pathway is standard. Okay, because I should think that would influence what we're due to be paid. So what I'd like you to do, Olivia, could you just click this set reset factors button and we'll see if anything's happened. It hasn't. We're still on standard, but it's really important that we do click that set reset. It's really important that we do click that set reset factors button. If we don't, it wouldn't pull through the most recent data. And when we click that set reset factor, I can't even say it, when we click that set reset factors button, it may change this pathway status when we pull that most up-to-date data through. Now, it didn't in this example, but it might do in a little bit. So Olivia, if you could be so kind as to click next for me. So as I just said to you a minute ago, we're scanning through this to make sure everything's in order. Now, obviously, you'd be using your clinical judgment when you're scanning through it. We're not really going to do a great deal of that together. All we're going to do is we're going to select no to everything apart from one thing. Olivia, if you could go to Oasis PN bladder dysfunction and click yes to that. You know, we did talk earlier on about the perineal and the bladder issues, and that option there would be related to what we discussed earlier. So if you could click next for me. And just for the purposes of demonstration, we're going to say no to everything on this screen. And again, just for the purposes of demonstration, no to all on this one. Now, when you click next there, we added that Oasis or PM bladder dysfunction, didn't we? And there we are. Based on calculations from the indicators on those pages where you change that option, it's now upped the care level to intermediate. And if you could click finish for me there, we can now see that that postnatal care level is now updated here, which again must have an impact on payment. So Claire, I really don't want you to put you on the spot, but I said you'd be like my secret weapon earlier on. So from your perspective, having a look at that form now, what do you think in regards to who should be doing it? Any thoughts?
That is definitely not an MSW, because I wouldn't
Okay.
expect her to check what's on
Okay.
that list and be able to confidently say yes or no.
Yeah.
It's another role for a midwife to be able to check that.
Okay.
I mean, it's quite good because it pre-populates it, so
It does.
nobody's having to make a decision whether she's on a standard, intermediate, or an enhanced pathway. But it's just that the midwives are going to have to remember to do that, otherwise
Yeah.
we're going to be poor, or even poorer than we are now.
The midwives would need to remember to make that part of the process.
Yeah.
Okay.
I
Claire,
think that's something that's going to have to go out on maybe sort of multiple messages through different methods, just to remind midwives to do that part.
So we're saying internally some comms as a
Yeah.
reminder would be a really good idea.
Definitely, and a sort of very quick guide just to remind people where to find that.
Sorry, and as well, if they weren't pre-populated, we would then need to find that information for ourselves before filling that in. Is that correct?
So what we're saying is, if all the wizards, for example, the ones that, I've just showed you examples of wizards
Yeah.
throughout this little course, haven't we? So if all those wizards, the risk assessments and everything else had been completed as part of the patient's journey, then it should all be pre-populated for you.
The only
And-
time it wouldn't be pre-populated if, say, a woman has not had any care with us and then just has her postnatal care, it's not going to be already on the system, I presume.
That's a good point.
That's something I'll discuss outside of the meeting and see the best way forward, I think, with that
Yeah.
one.
So again, I hate to put any more work on the likes of Michelle and Francesca, but yeah, I'm sure.
Yeah,
Maybe a
leave it
chat
with
with them.
me.
Okay, Claire, I knew you'd be a secret weapon. Thank you ever so much. Ideal.
I
It's
just
all right, I've
ask
got
you-
some questions in a minute.
You can ask questions now if you want.
I won't, because you may still have stuff to cover before I
Oh,
ask
okay.
my questions.
Okay, no problem at all.
Can I just ask a little question?
Amanda, please.
Some of my ladies deliver in a different hospital, so their intrapartum care isn't going to come up on this. So how would we then?
That's what I'm thinking with the babies. If you're only providing the postnatal care, that's my concern, is that this wouldn't then be pre-populated, which is why I probably need to have some further discussion outside of this.
But we do the antenatal, or they just deliver
Well,
in
yeah,
Lecture
but
So-
you might also have babies that women that
Yeah.
literally just come to you postnatally.
Yeah.
So I'll pick that up and we'll make a plan going forward.
Can I just add, just to make it even more complicated, we did recently have a baby transfer in that was a foster baby. So again, like mum had no care with our services, and it was literally just baby transferring in. So I don't know if that's also something that needs to be considered.
Yeah.
Thanks a million, Claire. I really appreciate you taking that
It's
away.
all right.
Right. Okay. Good stuff. And didn't Olivia do well? Thank you very much, Olivia. I don't know if there's anybody else I can possibly give control to. Okay, so Amanda, you had a go, didn't you? Olivia's just had a go. Amy King, you had a go, didn't you? Helen, did Helen have a go?
Yeah, I had to
You
go
did?
first.
You were up first, weren't you? I'm so sorry.
Okay.
Jodie's had a
I'm
go.
happy to have a go. I'll have a go if you want.
Oh, Claire, my secret weapon. Have I neglected you? Not for long. Not for long.
Yeah, I've done my bit.
Oh, go on then, go again. Yeah. The thing is, when people join, I'm not sure I can necessarily give absolutely everybody a go, because if you've joined through the browser and not the app, then you won't appear on my list. But as long as everybody's happy, Claire, are you okay to have another go? Yeah.
Yeah.
Oh, look, and what we've seamlessly demonstrated now is that if you're inactive for too long, then K2 will log you out just for security. So there we are. Challenge is, can Smithy log in properly this time? Get in, yes he can. Right. So good news all round at this point. And the good news is that we're really getting close now. So we're all progressing nicely through the course, and also baby is progressing nicely as well. So Bray baby has had a stay on TCW and is now feeding well. So we're going to pretend it's now 15 days on in the future, and we're satisfied with mum, we're satisfied with baby, and we're going to start thinking about discharging them from our care and transferring them over to a health visitor. Claire, you're going to come in useful again now. The MSW I was speaking to earlier on said, oh, I'm not sure if we would deal with transfer to health visitors as MSWs. Is that your under? Right, okay.
Yeah.
Okay, so this is
It
midwives
must be a
again.
midwife that discharges a lady and
Okay.
does the transfer of care.
Must be. I'm just scribbling that down because this is gold for me. It must be a midwife. Thank you very much. Okay, so Claire, what I'm going to ask you to do is if we can go to the postnatal tab again at the top, just next to the green baby button. The team's being twitchy. There we are. And then I'm going to ask you to go down to discharge from care. You're very close. Transfer to health visitor, please. Okay, now we don't see an add option here. Okay, so nothing to panic about. We've still got a pencil. So if we click on the pencil, please, the red pencil. Magic. Okay, I'm just going to take you through the form and give you the values. So newborn blood spot sample, yes, please. Safe sleeping assessment undertaken, yes. And feeding method will be breast, as we discussed earlier on. And let's have a comment, because it's happy days now. Feeding well, please. Okay, baby identified as high risk for Hep B. We'll have a no for that one. And baby follow-up appointments is a no. Moving down and avoiding the comments this time, we'll go for safeguarding concerns, no. And baby social worker, no. Other agencies involved, again, we'll skip those two fields, we'll go no. And other comments, please. I'm going to ask you to do some typing for me if you don't mind. No concerns with mum or baby. Yep. And then a full stop, please. And we'll say signposted to GP. And birth registration. I remember that many years ago. And then one more full stop, please, and one more sentence. Aware needs 6/52 GP check. Textbook. Okay, so if we could go to next, please. All right, so we get the mental health pop up. All right, so again, so as so many of you have done this training before, you would have covered mental health assessments previously. We did have a quick look at the form earlier on. So all we're going to say is we're not going to fill another one out now. We mentioned this after we did mum's assessment and a perineal referral. But please, 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 please continue to complete your mental health assessments as and where necessary, and I'm sure you would. Okay, so on this screen, we're going to go 6 to 8 week postnatal check arranged, no. Or yes, dependent on your scenario. Perineal trauma, as we know, is a yes for this lady, and we'll have a comment of healing well. So mum's on the mend as well. Postnatal problems is a yes for this lady's story. And if I'm sorry, Claire, more typing, I'm afraid. So received sepsis care, please. And she was in the hospital. I'll have a comma there, and she was seen at day 5 and sent to TCW previously. Yeah, for feeding problems. Comma, now resolved, because things are on the up. Okay, so we'll go next, please, if that's all right. In regards to mental health, we'll say clean bill of health there, so we'll go no to all. We're really close now, ladies. Yeah, and then in other mental health comments, we'll just put a comment that she is feeling well, for example. Yeah, fantastic, Claire. If we could go down to the bottom right-hand corner again and go to next. We'll say contraception has been discussed, and the method discussed was abstinence. And who can blame mum after everything she's been through? Yep, so let's go to contraceptive advice leaflet given no, just as an example, or it might be a yes in real life, but we're saying no this time. Women advised to visit GP would say yes, so just on the left there. It is a smoke-free household, so smoking cessation offered would be a no or an NA, whatever you think's appropriate. Safeguarding concerns, no, and social worker, no, please. And then we'll go next. Okay, contact number given for midwife is a no, but it's a yes for the health visiting team. Verbal handover, no, but she is aware that transfer of care has taken place. Referral to GP, no. Request for support is a no. And other agencies involved is a no. And if we just scroll right down to the bottom there, family and friends discussed with mother, if we go for a yes, and then we'll try next. We'll try next. Yeah, okay. I think they've made this field mandatory now when it wasn't previously when we wrote the planner. So it's if you click no for me, it's just asking for us to put something into the other comments. Again, I think this field has now become mandated all of a sudden. So I haven't got an example. Are there any comments you can think of that you might write in at this point? No pressure. Well, look, put it this way. You could skip it. So if you go next in the lower right-hand corner again, okay, you could go yes and proceed anyway. So time's getting on, so we'll just do that today. In the final handover comments, could you type in mother feels well again? I know it's getting a bit repetitious now, isn't it? Oh, there we are. Mother feels well, and if we could have a comma and a say aware of birth registration. It's kind of doubling up, I know.
You could actually use that box to write things like the health visitors
could.
like to know if the family have got like a big dog in the house and things like that. So you could fill that box with bits
What,
and bobs.
this one or the previous one?
On this one would be fine. You
Okay,
could
yeah.
either or really, as long
Okay.
as they get some of that information, or if the baby's had a bloodshot eye but it's all resolved, you could always pre-populate it with all that sort of thing.
See,
Can I
I
just
like.
ask?
Oh yes, please do.
So is this instead of the forms that we usually send them? So the health
Yes.
visitors get, this isn't just like documentation, it's actually going
No,
to them.
it will go to them, so
And
you
the
won't
Devon
have to
ones
fill
and
that
Cornwall
form in.
ones.
Yeah, I mean, I'll
Yeah.
see
I
what
think,
David
ladies,
shows us now in terms of when we finish it, what happens,
Yeah.
because it doesn't automatically get sent. I think, do we now send it and we have to put in an email address?
I think Helen Weeks is actually a mind reader because
Oh,
she knows
sorry.
what's coming next. No, that's absolutely spot on. So Helen, the answers are coming. And I'm loving the big dog reference because I was a trainer in the Royal Mail for 16 years and we like to know this sort of stuff. As I'm sure members of staff here like to know as well. Could you just close the loop on this comments box though, and we'll just write one final comment, please, and that would be baby over birth weight, happy days. Well, don't put the happy days bit in, but you know what I mean. There we go. And if you could finish this one for us. Thank you very much. And then we'll get on to what Claire's just mentioned, which is a really good question. So there it is. There's the transfer to health visitor recorded on K2. So the final thing, ladies, we are so close now to the end. The final thing we need to mention in this regard is that discharges to the health visitor will now, as you quite rightly just said, be sent via email. So I'm going to very, very quickly show you how to do this in Athena. So if we can go to profile on the top left-hand corner, please. Yeah, you got it. Profile up here, and then drag that mouse down very gently. And we're going to go over to communications and discharge to HV, discharge to health visitor. So from the left-hand side, could we go baby discharge to HV, to health visitor? And there it is. I'm sorry it says Chelsea and Westminster. It's just because we're in the training environment. So yeah, essentially, in answer to your question, we want to send this PDF. So if you could go to export summary for me in the top left-hand corner. And it was running really, really slowly. I'm sure you've just clicked on that. Yay, there we go. So here's the PDF. So I'd now direct your attention, everybody, to the mail symbol in the upper right-hand corner. So in fact, I'll do it. You've done enough. There we go. And we don't want to send it as a link. Okay, we actually want to send the PDF. And then I'm not going to do it now, but if we click to next, what would happen is it would take us to Outlook and this would already be attached. Okay, so does that make sense? Is everybody happy with that?
Yeah.
Yeah, cool. So if you just bear with me, I'm just going to cancel the control now. I'll take that down. Okay. Well, that's helpful. There are updates available, so I need to do a restart in a minute. Okay, so yeah, we're very, very nearly there now. So that's how we get that PDF for the transfer off to the health visitor, send the PDF and not the link. So we're nearly there. That concludes the journey for the mum, or the mums rather, and the baby who's allocated to mum number 2. And it almost concludes our training today. So just to remind you in regards to security, please lock your screen when you're away from it. It will lock you out anyway after a period of time. And then when we're done, we just go to exit like so. Now, if you just bear with me 1 second, I just need to do one last thing. And this is a special request from Francesca. So if you bear with me for a second, just a little loose end. So Francesca has asked us to show you a video in regards to demonstrate how to do a short booking. Okay, so all this is a short 3-minute video for a short booking. So I'm just going to fire that up.
I am going to show you how to do a short booking on K.
Ladies, did you hear any volume there? I'm thinking you might not have heard any volume on that.
No, I did.
Yeah.
Oh, everybody heard that. Oh, okay. We all heard Francesca say hello. So, Francesca, hello.
Hello, I am going to show you how to do a short booking on K2. So why might you need to do a short booking? So we're going to do everything we can to generate records on K2 for women who currently have paper notes. But that's a massive job. And there will be some situations where you're going to need to see a patient where they're not going to have a record, particularly in the first couple of weeks of implementation. So how do you manage that? So you'll notice we're currently in Athena, and what we're going to ask you to do is go to Teams, and then in your Teams, you're going to scroll down and you're going to choose the All Women tab here. And then up here, you're going to have the option for a new short booking. So you're going to search for your patient, name, hospital number. I'm going to pull the full list of patients because I'm playing in the test database, and I'm going to choose a patient. And it's going to run me through the minimum screens that I need in order to get this patient on the system. So as long as she's on Salus, then we'll be able to see her in K2. If she doesn't have a hospital number, then you'll need to speak to maternity reception to get her registered, and then K2 will have a record for her. So you can just enter the minimum data set you need here. So this is her booking appointment. It was requested today. She doesn't need an interpreter. She has not been previously seen in this pregnancy, and we are going to be her intrapartum lead provider. She's planning to have her baby at Derriford, at the obstetric unit. And she's previously had a different delivery place recorded on the system. So for that situation, we could just say not known. So her LMP is 13th of April, 2023. And we've agreed her EDD with her, and she's 28 weeks. And she can, for this purpose, just be listed as other. And then in here, you're going to say new record created. Hit next. So this is the really important part. You're going to look at her notes and decide whether she's midwifery-led care or consultant-led care, and you're going to record details of what team she's in, who her midwife is, if she has a consultant who's currently looking after her, and then we're going to move through to the next screen. You then here can just enter the absolute base minimum level of information required to be able to get you through the screens. And if you can enter her observations because you're seeing her in person, fantastic. If you're speaking to her over the phone and creating a record for any reason, then you can show that the observations have not been completed and give a comment as to why that's the reason. Thanks very much. Bye-bye.
There we go. Short and sweet. So we've just been asked to show that one at the end of the course. Okay, so
Can't hear you properly.
that's because I didn't put my microphone down. Schoolboy error. Can you hear me now?
Yeah.
Right then. Very, very well done, everyone. Thanks for sticking with it and bearing with me. Again, apologies if I wasn't able to give everybody control of the screen during the session. So just to round things off then, in summary, we've looked at the two mum scenarios and the baby scenario to demonstrate the functionalities of the postnatal outpatient aspect of the system. That's facilitated some practice for most of you and also generated the opportunity for us to have some Q&A. I hope you're feeling a little bit more familiar with the system now that you've had a chance to look at it with me and everybody else on the call here today. But there's no substitute, is there, for actually using it in the live environment and getting to grips with it that way. So hopefully today has been a good starting point for that. Please remember, I will send you an email either at the end of this week or the start of next week. And in that email will be the digitalsupport@nhs.net email address, should you have any further queries going forward. And finally, again, in that email, there'll also be a link to fill out a training feedback survey as well. Ladies, I appreciate you're all really, really busy, but if you do get the opportunity to give us any feedback on the training you received today, then all feedback is, as ever, gratefully received. And really, that's everything from me today, unless you have any further questions. And Claire, thanks for your help with the questions. You've got another one.
Sorry. Firstly, thank you very much for taking us through. That was really smooth. My question is, when you have completed an assessment for mum and baby, is there anywhere where it asks you to fill out when the next appointment is?
That may have been covered on one of the other training courses, booking future events. I'm going to have to hold my hand up now and say, Claire, I'm absolutely unaware of that. I'm not saying
That's
the
fine.
functionality doesn't exist. I'd recommend, again, I don't want to put any more work on the ladies because I know they're really busy, but perhaps just double check that one with Michelle or Francesca, please.
Will do, thank you.
Any more from anybody else, please? I'm going to take that as a no. Thank you all very much for your time today, and I'll let you go now, and the best of luck using the system going forward.
Thank you.
Thanks
Thank
very
you.
much.
Thanks, everyone. Cheers. Bye.
Bye.
Thank you. Bye.